For this section, we're out at the offices of Family Practice Associates, and out at the office here we do a lot of chronic care with diabetes and high blood pressure. We see bronchitis and the flu, we do stress tests, lumps and bump surgery, laboratories. We also do physicals, and as part of that physical, sometimes we end up doing a bone density, which is a screen for osteoporosis. My next guest is Miss Angie Burberry, who is our bone density tech at Family Practice Associates. So bone density, we're looking for screening for osteoporosis. And osteoporosis is looking for weak or brittle bones, which is different than arthritis in terms of joint pain.
Yes, sir.
So we're looking to see how strong the bones are. So take us through a bone density test. Tell us what happens.
First thing we do is I do a little assessment of the patient. We check their risk factors. We want to know if they're menopausal age, family history, if they've had a fracture as an adult from a simple fall, if they're on certain medications that can cause some bone loss, which would be chronic steroid use, if they have hyperthyroidism, that can cause some bone loss. Other risk factors would be a smoker. Caucasians and Asian women are more likely to have those. At this time, we're now doing some men over 70, and we've actually found some people with osteoporosis, so it's nice that we're screening our patients for that.
Yeah, so it's a pretty simple deal.
It's a simple
Show us what happens.
Okay. First I do an assessment of their lumbar spine, and we have to look at the lumbar spine vertebrae 1 through 4. I get a density of each of the vertebrae, and then it's going to average out each density to let me know how thick it is, and then it'll give an average of all 4 together. The next one I'm getting ready to do is scan the femur bone. We look at the hip socket. The femur goes into the hip socket. We're looking at the head and the shaft of the bone. As you can see, it's an easy test. It's non-invasive. The patient just lays still, and we just scan both hips and get the average of those. So as you can see, it's going to start scanning. It's very non-invasive for our patient. As long as they're not wearing any zippers or metal, they don't have to get undressed. We just fold them out of the way, so it's very non-invasive. It's easy for the patient to do.
So easy, just come in here, basically lay down.
Talk to me, we do the test. So it's very.
Goes over them. Correct. Radiation is really.
Radiation is like being out in the sun.
Okay.
I worn a badge for 10 years. I've never had anything on it, so I feel pretty safe with it for the patients and myself.
Right, now, why this is scanning the patient here, show us, you got a little model, a bone model, and explain osteoporosis to us.
I've got a little model here. The one on the left shows vertebrae with osteoporosis, so you can tell how weak and brittle it is, how easy it is for a patient. You hear them say, I fell and broke my bone. Most of the time it just kind of gives out. This is their vertebrae. This is what the healthy bone is supposed to look like. But as you can see with osteoporosis, it kind of compresses, and you notice how women lose like 4 or 5 inches.
Yeah, so if you're getting shorter or getting hunched over, you may well have osteoporosis and need that.
So that's one of the signs that we need to check you if that happens. We do a risk assessment with our bone density. So that helps with the risk factors it looks at the risk factors in 10 years of developing osteoporosis, and also the risk factor of having a hip fracture in 5 years.
So if you have a major fracture risk, if you are osteopenic, osteoporotic, you may want to consider treatment.
Correct.
Now, with osteopenia, that's before you get to osteoporosis, and you want to make sure that you can maybe try to do things to prevent it, like exercising, specifically weight-bearing exercise. You want to make sure your vitamin D level is okay and you're getting adequate intake of calcium and vitamin D, and definitely follow your bone density scan serially over years.
Yep. You want to make sure you're taking vitamin D with your calcium, because that helps your body to absorb the calcium better. With the weight bearing, we recommend walking with hand weights. That's going to strengthen your back and your legs as you walk. So we recommend that for our patients.
Now, if you have osteoporosis, true osteoporosis, and you're at risk for major fracture, or you're already shrinking and hunched over, you may want to consider a medicine. And some of those medicines can be taken weekly. Some of them can be taken monthly. They can be given as an injection or as an infusion, only like once a year. Now, if you have osteoporosis, you ought to see your doctor, because these medications are not without side effects, and so you really need to know if they're appropriate for you. So that's some great information for osteoporosis, easy bone scan or bone density test, and we're going to go back to the studio for more good information.